All right, we can go ahead and get started. Welcome and good morning to the Vaccine Tracking Service webinar. I'm joined with my colleague Laura Mandel and Tim Hoy. We will be talking about the vaccine tracking service broadly, but also mainly focusing on the addition of the flu vaccine. And we are happy to give you some background and show you a demo of how um, you utilize the flu vaccine in these reports. Um, our session will cover a brief overview of the vaccine tracking service. And then, as I mentioned, we'll go into a demo of the new flu vaccine option. Before we get started with the background, I did want to mention that this session is being recorded and we will distribute both the slide deck and the recording to all attendees, as well as post that on our website for folks to find later. We do have a detailed user guide on the vaccine tracking service that can be found in the CRS portal. And lastly, we do have the audio lines muted just during the presentation. We should have plenty of time at the end for question and answer, but if you do have a question as we go through any slide, don't hesitate to drop it into the chat box. So when we get to the Q&A part of this session, we can go ahead and circle back and answer those. So feel free to use that to drop down any notes. And with that, I'll move into the background of the vaccine tracking service. All right, so the vaccine tracking service is a web-based application that enables physicians and payers to track their patients' vaccination status and prioritize an outreach to unvaccinated patients. The reports are populated using daily vaccination data from Immunet, Maryland's immunization information system, and then the list or the patient list come from our ENS panels or MDPCP practice attribution list. We also have chronic condition flags that are based off of claims data. Summary level reports help practices understand the proportion of patients that have been vaccinated by demographics to ensure their population is vaccinated over time compared to performance of relevant peer groups. Users can use the patient navigation report to segment their population by age and chronic conditions to focus outreach efforts on those who are most vulnerable, and customize fields to allow users to document their outreach efforts with those particular patients. Previously, this report, the vaccine tracking service, only displayed data for the COVID-19 vaccine. And now we are happy to announce that the report does contain the flu vaccine as well. And when Laura shows her demo, she will show you how to navigate between both of those two options. And here is a little bit of what the report looks like. I just took a couple screenshots here. There are primarily three reports in the vaccine tracking service. The first one is our summary report. The summary report focuses on the individuals vaccinated by demographics such as age, gender, race, and ethnicity. This report shows the number and percent of patients that have not been vaccinated or have completed their vaccine schedule. And then we also have what we call the vaccination disparities report, which you can see in the bottom right of the screen. This allows users to compare across demographics to identify potential disparities in vaccinations to ensure equitable allocation of vaccine within these different groups. And then our third report within the vaccine tracking service is what we call our population navigator. And here's where you'll find patient records. Please note that this screenshot and then the demo that Laura is going to give are all fake data, so there's no real PHI here. But this module is designed to allow users to identify patients who have not been vaccinated and track outreach efforts to those patients. It contains patient-specific information such as demographics, vaccine information, and contact information. Other functionalities include user editable fields for outreach tracking, and then custom filtering to allow users to slice and dice the table as they choose. Focusing a little bit now on the flu vaccine, we just want to make sure you understand specific specifications or how we defined some of the variables within the report. Firstly, the timeline on what we consider someone to be fully vaccinated focuses on the yearly flu season. So from July 1 to June 30th. Individuals are considered vaccinated if they have received one dose of the flu vaccine between July 1st and June 30th of the particular flu season, or what we call the vaccine year. Any individual who has not received the flu vaccine in the current vaccine year will be listed as not vaccinated until they receive the vaccine. The vaccine year is updated each year as we move into the next flu season. Individuals who are under 6 months old are not eligible to receive the flu vaccine and are not included as the patients who are listed as not eligible, and therefore they won't show up in that vaccine status category. That is the general background of the vaccine tracking service. Now I'll move into how you actually get access and where you can actually find the vaccine tracking service. So the vaccine tracking service is available through our CRISP reporting services portal, or CRS. The report is located within the public health category. So when you first log on to the CRS portal, you'll find a couple boxes of categories of reports. What you're looking for is the public health report. When you click into that, it will display all of the public health reports that you have access to. What you're looking for is the one labeled vaccine tracking service, and then you can click into that box and arrow icon to go ahead and launch the application. In order to get access to the vaccine tracking service, your organization must be a practice within the MDPCP program or have an active encounter notification system, or ENS panel, with CRISP. And the reason why we require this is we use the MDPCP attribution or your ENS panel as the patient roster in which you will see statistics for the vaccine, as well as what patients will populate your population Navigator report. So if you have either of those two things and you don't have access to the vaccine tracking service, you can reach out to your outreach representative or email support@crisphealth.org. Or if you do not have an ENS panel currently and you would like to set one up, you can reach out to your outreach representative who can help you with next steps. But if you are in one of those two categories, you can go ahead and get access to the vaccine tracking service and start using the tool through the CRS portal. And that covers how to get access to it and some of the requirements you need to have access to the vaccine tracking service. With that, I'll actually turn it over to my colleague Laura, who will actually show you a demo environment and walk through how to get to the flu data and then all of the different tools available to you within these reporting suites. Laura?
Thanks, Kevin. If you stop sharing, I think I should be able to. Yeah, perfect. Can you all see my screen?
Yep, we can, Laura.
Great. So if folks have been using the vaccine tracking service to look at COVID, this will not be any different for you. It looks the same. The only big difference is you'll go right here to this drop down and click on flu instead. That'll let you be able to see all the flu vaccine data. And like Kevin said, what I'm going to be showing you today is a demo panel. So it's no real data. So if things seem a little bit funky, or you're like, I don't think that makes sense that that person got one based on like who they look like. It's just fake data. So it's not worth kind of sort of digging in there, but just to sort of give us a chance to look at it. So as Kevin mentioned, we have this flu vaccine summary. And unlike COVID, we really have three options here. We have not eligible, not vaccinated, and vaccinated. Not eligible is really limited to those who are under 6 months of age. So in this demo panel, there's no one who is under 6 months of age, so there's no one who isn't eligible. You can see that the practice is split about half and half, vaccinated and not vaccinated. And again, that's vaccinated this season, this flu season. Because we have sort of established seasons of flu, we can actually look at just a specific time to see if they got a flu vaccine this year. So again, this is just looking at this year and not the previous years. And then you can see things like how this breaks down by age group. Let's see if maybe you're more vulnerable folks who are in the older groups, if you're getting better coverage there, or if that's sort of an area you need to focus more on. And then you can see it by gender as well. And this looks pretty even in this demo practice about the male and female. But if it's not, that might be something you would want to look into and see if there's some reason why some people in your practice are not, uptaking the flu vaccine. And then we can see by race. Similarly, you can sort of see if there's any differences here or if there's any disparities that are coming up. Then, as Kevin mentioned, we have this disparities tab, which lets you look at this a little bit more in more detail. So we have the patients in the demographics group. Within this 0 to 19, you can see that a little over half are not vaccinated. And you can see kind of these numbers change. And in this demo panel, they're pretty even across the different groups. But, it might be different, and that might be something you want to see within each group. You might see that difference. Again, you can also see this by gender and by race. And on both of these tabs, you're able to print out the PDF of these graphics or in Excel that will show you this information as well. If you have multiple panels, so let's say you have an MDPCP panel and an ENS panel, you can click here for the dropdown and select the panel that you're interested in. And then finally, we have the Patient Navigator. And the Patient Navigator lets you see all of the patients on your panel, along with information about them and the flu vaccine. So I'll just walk through these columns here and explain what they are. And again, some of these are going to be pretty similar or familiar to you if you're used to using the COVID one. So we have the vaccine status. Again, this is the vaccine within the past flu season. And so it'll have vaccinated, not vaccinated, or not eligible. Then we have outreach status. This is something you can enter in yourself. So you can click in here and be able to put in these three options here. You're also able to put in notes to fill in. This information may be shared with other users who may not be affiliated with your practice, but it's helpful for you potentially to track what's happening and whether other folks in your practice have contacted the patient or not. If the person has had a vaccination, they will have this field filled in, which is the administering date. So it'll say when they got that vaccination. It'll also say if they had chronic conditions. So you might want to make sure that the folks who have a lot of chronic conditions, who are super vulnerable, are the ones who are getting that vaccine, and you might want to prioritize that outreach. So we have that available for you. Then we have a flag here, which can be really useful, which is whether or not they received the vaccine last flu season. And so if you want to know maybe if people are used to getting the vaccine, and so maybe they just didn't get around to it this year, and so maybe a nudge would be really, really helpful to sort of get them to sort of make that appointment or go get that done. Then you can use this. If it's someone who hasn't gotten it last year, they might be more vaccine hesitant, so they might require a different type of outreach. And then we have some information on the vaccine that they got, what the name was, and which organization facility actually provided the vaccination. Then we have the patient's date of birth, their gender, where they live, their race, ethnicity, state, and zip code. You're also able to add in some other columns. So if you click on any of these drop downs here, you're able to see these columns. And so you're able to select some more information. Let's say I wanted, the last name out, I want the home phone number. You're able to select these and sort of customize this view to more what you're interested in looking at. Some other things is if you click here on each of these columns, it's going to sort it for you. So let's say you want to sort by zip code. You can click right here. It'll sort that by zip code for you. And let's say I only want to look at folks in Maryland. I'm going to filter, go here to this filtering button, and I'm only going to filter for Maryland. That'll limit my list to really the folks who live in Maryland. And so let's say I wanted to see folks who are not vaccinated and live in Maryland and have received the vaccine last year. So maybe these are the folks who might be a little bit easier to get to say yes. So now my list is a lot shorter than it was before. And these are the folks that I might want to prioritize for outreach. Because I've selected all those filters, I can actually save this filter. I'm going to call it Maryland, not vax, previous vax. I'm going to save that, and now I'm going to clear it. But if I want to come back to that in the future, I can go and click on that previous filter to see how I'm doing on that list of patients. That's a much smaller list of patients. It might be a lot more manageable, and folks who might be more likely to say yes right away. So that might be something that you want to do, and play around with those filters can be really, really valuable in helping you do the outreach. And then you can do an Excel export. Of course, because this is PHI, we really want to make sure that you know that that data is being saved securely and safely on your system. And then one more thing to note is you can actually click on the patient and you'll get a sort of bigger summary here. You'll have a lot of that same information that you had, but you'll also include what other specific chronic conditions that patient has. And you can put in, it's a little bit easier to use the outreach status and notes column here as opposed to be within the table, but it's the same information that you can enter in both places. Another way to do some filtering is by clicking on chronic conditions, and you can select the chronic conditions to really filter for those people who have those needs. If you really want to look at only people who have heart failure, you are able to do that. Of course, I've already filtered it a lot, so there's less filtering to do. So among those folks that I filtered already, only 2 of them don't have hypertension. So they're the ones that show up here. I think I've covered most of the issues or pieces. If there's anything I missed, Tim or Kevin, please let me know, and we're open for questions.
Thanks, Laura. We had a couple questions come through. Someone asked, what is the best browser to use when using these reports? Do we have a preference?
I will jump in on this one. I don't think there should be any issues. I mean, I think any modern browser will work. I mean, I personally use Chrome, although, using Edge or something like that, I think probably the only limitation I would say is that like older systems that are still using like Internet Explorer may not be the most optimized. But yeah, any modern browser, will work fine.
And then, are we able to see the COVID vaccine and the flu vaccine together?
Right now, we don't have them together. That's something we're going to think about in the future on how to group vaccines together. Right now, they are separate drop-downs. So we'll definitely take that into account in the future and sort of think about how we can optimize that for folks, but right now they are separate.
Awesome. And can you remind us how often this data gets refreshed?
It's updated daily with the new Immunet data. So typically, if a provider is sending in data to Immunet, one day we'll get that information in, and then we should be able to show it in the reports the next day if there's no delays.
Awesome. Back to filtering, when you are saving a filter, is that filter viewable only to you, or can other folks who have access to the same panel within your practice also view that filter?
That saved filter is only specific to the particular user. If there are, filters that would be like broadly useful, you think, in your own usage of the tool that you think may be helpful to share with other users, please let us know and we can, evaluate the request and see if that makes sense to make it a global filter that, gets shared with everyone. But yeah, for now, they are just user specific.
Awesome. Thanks, Tim. Those are the questions we have so far, but folks we still have a lot of time. So if you want to ask something in the chat or come off mute, you're welcome to do so.
Hi, this is Julie Pulling. I was the one that asked about the internet browser, if there was a preferred browser. I've been in Backtrack before many times, but in the past couple months, I haven't been able to get past the vaccination summary screen. It just keeps loading, so I can't even do anything. So that was why I was asking if there was a preferred browser, because I'm using Chrome. And I tried it in Edge, and it's still not letting me in.
Got it. Let me look into that a little bit more for you to see if I can see if there's anything specific going on for your session. I know a couple months back we had some performance, I don't want to say issues, but slower performance for really large panels. I mean, panels over like 1 million people.
Yeah, it's us.
Okay. Yeah, that should have been resolved. I mean, it's not like it's taking 2 seconds to load, but it should be loading in 10 to 15 seconds is what I saw in my review. Yeah, if you're still having issues with this, let me take another look at this and see what I can do with that. And I guess to answer your question, all of that is happening on the like sort of backend side of things,
Okay.
rather than in the web browser. So like, as long as you're using Chrome or again some modern browser like that, that is fine. It's more of a backend issue just of physically loading that much data. So
yeah, I didn't have issues before, and I think it was a couple months ago when I started having issues, and I haven't been able to get back in since.
Okay, yeah, let me take another look at that and just make sure that everything is going okay there. And yeah, someone will get back to you on this.
All right, thank you.
Yeah, thank you for raising that.
Thanks, Tim and Julie. We had a couple questions come through as you guys were speaking. Are there other vaccines that the team is considering to add into this tool?
There are. We're working on pneumonia right now, and we're thinking about in the future how to sort of organize and what kinds of vaccines we can sort of group together. And so that's something we'll be working on and potentially reaching out to folks to do some focus groups to try to figure that out. So definitely stay tuned. We are looking to put more in here. So you can let us know if you have specific ideas, but we will definitely be working on that.
Awesome. And then this next user asks, what is the best way to report if they see an error with either some of the patient contacts or the vaccine status doesn't meet what the patient is telling them or what they have in their patient record? What is the best way to kind of talk to us about that?
Yeah, so we're getting the vaccination data directly from Immunet at the state. So really doing the outreach with them to sort of report that there was an an issue with what was reported or it's something different there, that will be the best way for that to come through, because we don't have control sort of over that data that's coming through to us. If your concern is about the patient contact information, I would say probably make sure that it's right in your system, and so that way it's getting into our system correctly as well.
Awesome. Thanks, Laura. Any other questions folks have?
So this is Julie again. I don't know if this is the right place to ask this, but it was for the COVID vaccine. I know there were changes a couple months ago. I haven't been in since I've had issues, but I think for the patient navigator, it kind of changed a little. So now there's so there's like the primary series, the latest, and the doses received. I guess my question here is now we have data for the first vaccine and the most recent, but everything in between is not listed in there anymore. Is that correct? So if someone got 4 vaccines, we'd only see the first and second, but then have it counted, but the actual manufacturer is not in there.
So it'll be the latest booster date that's received. So really trying to build off the fact that like when we have the bivalents, that's sort of the key piece, that knowing someone had the primary series and then they had the bivalent is sort of that important piece of information in terms of what you're going to be doing outreach for. So that's what it's sort of focused around. Instead of having 1,000 different columns for each booster, we wanted to make it a little bit more usable and really focus on what is the action that you need to take, and that action being, do they have the primary series, and then do they have that booster, that most recent booster that people need to get to be considered up to date.
Okay, is that available as an additional filter on the right to get the stuff in between, or is that not?
I don't think it's currently available. Can you explain sort of why that information would be useful?
So for us, it's not necessarily just for outreach. It's more so like how many vaccinations are administered type thing. So if we don't see the complete picture and what manufacturers that they're using, we don't have it for using this tool.
Okay,
right. And so, yeah, I was going to add, you'd be able to see, just a simple like number of doses using that like number of boosters column, but you're right that manufacturer information is not available. Again, sort of to build on what Laura was saying, is that like the intention of this particular tool is really focused around outreach and not necessarily reporting. Okay. And so one of the things that people were running into is that especially for the older population that is eligible for multiple boosters, and this was, I don't know, in the summer, before the bivalent vaccines were released, is that people would have to filter the based on people who have only received 1 booster, and then do a separate filter for people who have received 2 boosters to identify who is eligible for the bivalent vaccine. Which was a really cumbersome workflow and made it really hard to track, like, hey, who is actually able to get this vaccine right now? And so, I understand the use case that you're getting at of like, hey, we're trying to track all of the vaccines received, but we sort of had to compromise that functionality so that we could make it easier to do this outreach.
Okay, yeah, that helps.
Outreach specific.
Outreach specific, I think that helps. We're more, we were using it more for, counting of certain things in addition to outreach. And we use it in combination with other data sources. So like having the manufacturer and the different dates, which is helping us like dedupe it with like other data sources that we were using in combination with this, so that we're not counting, Julie got 3 vaccines that was reported at 3 different things. I didn't get, 9, I got 3. And the only way we were able to dedupe it was by having like the date and the manufacturer for everything. But I understand this is more for outreach, so that kind of helps explain why it's designed like this. So thank you.
Any other questions or anything, Laura and Tim, you want to add?
Thank you everyone for your time, and for feel free to reach out to us if you have any questions or concerns. Happy to help, and I'm happy to help you guys do outreach for your patients.
All right. Thanks, Laura. Thanks, Tim. Thanks everyone for joining. Have a great rest of your day.